I get to hear a lot of questions. I get to see a lot of patients, but I get exposure to hundreds, thousands of people who have had a total knee replacement because I am the administrator of a Facebook group called the Total Knee Replacement Support Group for Kind People. And one of the comments that comes up kind of periodically in the group, I'm going to read one now, but I want to talk about it. The comment reads, I'm curious to know how many post-op patients that are having pain and regret the surgery have continued with physical therapy 2 to 3 times per week. Now, when I first read the question, I wasn't totally sure what the group member was asking. I didn't know if they wanted to quit therapy, if they thought therapy was beneficial. I didn't know exactly what was going on. But I do want to take this opportunity to say that I don't know what the healing phase is for this individual. I don't know if they're a couple weeks or a couple months or where they are. In a recent video I just published, I had said 20% of the people who have a total knee replacement, at least by the statistics, are either worse off or just as bad as they were before surgery. And I know that it can be incredibly frustrating. I'm fortunate in that I get exposure to a lot of stories. I get to see a lot of people. I get to hear the good and the bad. And so I've never had a knee replacement, so I don't pretend to say that I know what any of you are going through. But I will say that those individuals that are frustrated, those individuals that are not getting the outcome that they expected, occasionally it's because it's just too early in the process. I think reasonably you cannot expect to have start feeling better before the first 4 to 6 weeks. I think you're still recovering from the trauma of the surgery itself, and then the history of how long you've had the knee pain and the discomfort prior to surgery. But I work with a lot of people that have had their knee replaced 3 months ago, 6 months ago, 12 months ago, and they're still experiencing redness, pain, swelling, difficulty walking, limited range of motion. So I can empathize with the frustration of that. And in a lot of cases, the best advice, I don't have a cure, certainly. I don't think anybody does. If we did, we would deliver it. But the best thing we can do is try to analyze the whole situation. Try to look beyond just what's going on at the knee. Try to find, is there anything we can do for the hip, for the ankle? Is there anything we can do to improve the musculature above and below the impaired joint? And then go back into, what was the original intent of the surgery? If it was to manage, minimize, eliminate the pain in the knee joint, why did we need to do that? So we could improve function. Let's focus on function. Let's try to take a bad situation and turn it as positive as we can. And then, of course, surrounding yourself with the right team. Having the right surgeon in your corner, the surgeon that's going to be encouraging, the surgeon that's going to share stories and let you know that you're not alone, because you're certainly not. If there's 800,000 knee replacements being done in this country per year, 20% of those are having challenges. There's hundreds of thousands of people that are experiencing the same kind of frustration that you are. The thing is, you don't know because you don't have access to those people. So I hope to bring those stories out, help those people that are frustrated and struggling because of pain, range of motion, strength, any of those kinds of issues, and really say, okay, let's acknowledge where we are. Let's see what we can do to improve, and let's just take one day at a time. If we have a good day, awesome, let's celebrate. If we have a bad day, let's give ourselves a break. Let's not beat ourselves up. Most of the time, the individuals that I work with who are challenged with a complicated knee replacement, they're working just as hard, if not harder, than the people who are breezing through the recovery. It's not a lack of effort that is causing them to have these problems. It's something that we just don't understand. We just don't know what it is. So I would ask you, give yourself the same kind of patience that you would give somebody else who is going through this condition, because most of the time I find that patients are harder on themselves than they would be on a loved one or a spouse. Give yourself that same courtesy. Take it one day at a time. Find the team that's supportive. Find the team that really can understand what it is that you're going through and help you through this challenging time. Because we're all going to be there. We're all going to have challenges that we feel like we can't overcome. And the best way to face them is with a team that supports us. I hope that was helpful. If you have more specific information, go ahead and put it in the comment. I'll catch you on the next video.